This is the audio recording of the Doctor of Nursing Practice project by Kayla Jessic at the Florida State University on atrial fibrillation and the associated increased risk of dementia and Alzheimer's. Thank you for participating in this study. After completion of this evidence-based PowerPoint, the participants will be able to state the associated risk factors that increase the risk of developing dementia in patients with atrial fibrillation, acknowledge the modifiable risk factors that can decrease risk of dementia and Alzheimer's in patients with atrial fibrillation, and utilize the information provided to educate patients with atrial fibrillation on methods to decrease risk of dementia and Alzheimer's. At the conclusion of this PowerPoint, you will be asked to enter your first and last name and an email address if you would like to be included for a 2-month follow-up survey. This presentation will discuss the relationship between atrial fibrillation and the increased risk of dementia and Alzheimer's. Atrial fibrillation is a supraventricular tachyarrhythmia with uncoordinated atrial activation and consequently ineffective atrial contraction and reduced atrial kick. In the next slide, you will see an animation comparing normal sinus rhythm with atrial fibrillation. In this slide, you can see how in normal sinus rhythm on the left side of the video, the beats originating from the SA node travel down to the AV node, resulting in equal beats between the atria and ventricles. On the right side of the video, you can see the irregular beats and uncoordinated signals between the atria and ventricles, resulting in atrial fibrillation. What is dementia Alzheimer's disease? Dementia is the loss of cognitive function, thinking, remembering, and reasoning, and behavioral abilities to such an extent that interferes with a person's daily life and activities. Dementia affects an estimated 47.47 million worldwide, according to the World Health Organization in 2015. It is estimated that by 2060, 13.9 million Americans aged greater than 65 years will have Alzheimer's disease and related dementia, which is more than double a 3.3% increase from 5 million adults aged greater than 65. Signs of dementia and Alzheimer's include memory that disrupts daily life, challenges in planning or solving problems, decreased or poor judgment, and changes in mood or personality. These signs and symptoms can come on gradually. For instance, the patient may forget to take their daily medications, which has a direct result on their health. Shared risk factors between dementia and atrial fibrillation include hypertension, diabetes mellitus, hyperlipidemia, heart failure, and physical inactivity. After a thorough review of literature, studies regarding atrial fibrillation and the associated risk of developing dementia and Alzheimer's emphasized the importance of improving overall health and managing atrial fibrillation. This diagram depicts the shared risk factors between atrial fibrillation and dementia. Notice how many of these shared risk factors are modifiable. As healthcare providers, it is essential to educate patients on the importance of managing their atrial fibrillation along with their overall health and early lifestyle modifications. For example, patients with hypertension should take their antihypertensive medication, adopt heart-healthy eating habits, which include low-sodium diet and participating in at least 1 hour of exercise per day. While no single direct link has been proven, 3 physiological effects have been proposed as potential links between atrial fibrillation and an increased incidence of dementia and Alzheimer's. The 3 physiological effects that have been hypothesized to contribute to the increased incidence of dementia and Alzheimer's in patients with atrial fibrillation include systemic pro-inflammatory state, cerebral hyperperfusion, and silent cerebral ischemia. I will discuss the 3 mechanisms in greater detail within the next few slides. These 3 physiological effects resonate within the literature as the leading development of dementia and Alzheimer's in patients with atrial fibrillation. This diagram depicts how atrial fibrillation can lead to systemic inflammation, cerebral small vessel disease, example given silent cerebral ischemia, and cerebral hyperperfusion, which in turn can precipitate development of dementia. The pro-inflammatory state created from irregular heartbeats increases inflammation in the body. The irregular rhythm creates a prothrombotic environment which causes cerebral microvascular changes, manifesting as development of cognitive dysfunction. On the next slide, I will show the graphs on the median levels of interleukin 6 and 8 from a study by Luba et al. 2008 and how these levels vary between permanent AFib, paroxysmal AFib, and controls. In this diagram, you can see interleukin 6 and 8 remain highest in patients with permanent atrial fibrillation. These samples were taken from the femoral vein shown in the graph as FEV, in the right atrium shown as RA, the coronary sinus shown as CS, the left superior pulmonary vein shown as LSPV, and the right superior pulmonary vein shown as RSPV. Cerebral hyperperfusion can be a result of the arrhythmia atrial fibrillation due to the low cardiac output produced from the heart with beat-to-beat variability. This creates intermittent hypoxic environments due to the beat-to-beat variability, resulting in decreased cognitive function, which can lead to the development of dementia. At the top of this slide, you can see the difference in waveform between atrial fibrillation and normal sinus rhythm. The irregularity from the AFib depicts the varying perfusion that results from the arrhythmia and causes the hyperperfusion for this patient, as compared with normal sinus rhythm, which has a regular beat providing strong perfusion to the patient. During atrial fibrillation, there is blood stasis in the left atrium, creating thrombi that can be dislodged, resulting in silent cerebral ischemia. Silent cerebral ischemia, or subclinical strokes, are that which can be a result from microemboli that travel to the brain and can lead to dementia. The microemboli that deposit within the brain places the patient at a higher risk of cognitive decline and 2 to 3-fold increase of dementia. Fortunately, there are actions that can be taken by patients with atrial fibrillation to help decrease their chances of developing dementia and Alzheimer's. It is important that we provide as much education to our patients as possible that includes limiting alcohol intake, smoking cessation, maintaining a healthy weight, increasing physical activity, and complying with prescribed medications, including antiarrhythmias and anticoagulants. I would like to thank you for your participation in this survey. You will be receiving a 2-month follow-up survey if you enter your name and email address at the end of this survey. Thank you.